Another day, another video of first aid by Blue Waffle Disease, cause, diagnosis, treatment and prevention, first aid by Blue Waffle Disease is an urban legend that has been circulating since 2009. It is a supposed sexually transmitted infection that is characterized by a blue discoloration of the female genitals. Despite being widely circulated, there is no scientific evidence that Blue Waffle Disease exists. The name itself is highly offensive and disrespectful, and it should not be used in any medical or scientific discourse. What is Blue Waffle Disease? Blue Waffle Disease is a fictitious sexually transmitted infection that does not actually exist. There are no published medical reports of this condition, and it is not recognized by medical professionals. Despite this, rumors about the disease have circulated on the internet since the early 2000s. The name blue waffle is derived from the idea that the vagina becomes blue and swollen after infection. The symptoms supposedly associated with this condition include a blue discoloration of the vagina, a foul odor, itching and burning, and a general feeling of discomfort. However, as there is no scientific evidence to support the existence of this disease, these symptoms are likely caused by other, more common infections. Is blue waffle a real disease? No, blue waffle is not a real disease. It is an internet urban legend that originated in 2009 and has since been circulated as an easily recognizable name for a supposed sexually transmitted infection. In reality, blue waffle does not exist and there is no scientific evidence to indicate that it is a real medical condition. The term is often used to describe a fictitious disease in order to shock or disgust the reader. Causes of blue waffle disease. Blue waffle disease is caused by a number of factors, including poor hygiene, unprotected sexual activity, and douching. Poor hygiene is one of the most common causes of blue waffle disease, as it increases the risk of bacterial, fungal, and viral infections. Unprotected sexual activity can also lead to blue waffle disease, as it increases the risk of contracting an STD. Douching can also be a potential cause of blue waffle disease, as it can disrupt the balance of bacteria in the vagina and increase the risk of infection. All of these factors can contribute to the development of blue waffle disease. Diagnosis of blue waffle disease. A physical examination and laboratory tests are essential steps in the diagnosis of blue waffle disease. During the physical examination, the doctor will inspect a patient's external genital area for any abnormal discoloration or lesions. The doctor may also take a swab sample from the affected area to test for the presence of bacteria. In addition, they may order laboratory tests, such as a urinalysis or blood tests to look for signs of infection. These tests can help to rule out other infections and help the doctor to confirm the diagnosis of blue waffle disease. Treatment of blue waffle disease. When it comes to the treatment of blue waffle disease, antibiotics are commonly prescribed to reduce the risk of infection. Additionally, warm sitz baths can provide relief from the pain and discomfort associated with the disease. Finally, it is important to observe proper hygiene habits, such as washing the genital area regularly and avoiding sexual contact until the infection is fully healed. By utilizing a combination of antibiotics, sitz baths, and proper hygiene habits, it is possible to effectively treat blue waffle disease. Prevention of blue waffle disease. Practicing safe sex is the most effective way to prevent blue waffle disease. This includes using condoms during sexual intercourse and abstaining from any kind of sexual contact with an infected partner. Additionally, maintaining good hygiene is important to prevent the spread of the disease. This includes regularly washing the genitals with soap and water, wearing breathable and loose-fitting clothing, and avoiding douching, as this can disrupt the natural pH balance and increase the risk of infection. Taking these precautions can help to reduce the risk of contracting blue waffle disease and other sexually transmitted infections. STD versus STI, what is the difference? STD stands for sexually transmitted disease, which is an infection that is spread through sexual contact. STI stands for sexually transmitted infection, which is an infection that is spread through sexual contact and can lead to an STD. STIs can be spread through skin-to-skin contact or through contact with bodily fluids, such as semen, blood, or vaginal fluids. Conclusion. In conclusion, blue waffle disease is a serious and potentially life-threatening infection of the genital area that is caused by a combination of bacterial and fungal infections. It is important to be aware of the signs and symptoms of this disease, including pain, itching, and discoloration of the genital area, to help prevent it from occurring. Prevention is the best way to avoid this disease, and it can be achieved by practicing good hygiene, avoiding unprotected sex, and seeking prompt medical treatment for any signs of infection.